y'all, today our NCLEX question of the day says, the nurse is caring for assigned clients. The nurse should first assess the client who, what? So notice that word first is in bold. We are going to look for our client who is at highest risk here. Option 1 is the client who has a femur fracture and altered mental status. This is going to be our correct option. So we know that with long bone fractures, we can have fat embolisms. So that also can then lead to a stroke. Altered mental status is a manifestation of a stroke. So this is going to be our priority. But let's look at our other options too. Option 2 says has a hip fracture and a discrepancy in leg length. That's a common finding expected really with a hip fracture. As that joint, is moved, our legs are going to kind of look different legs. And then option 3 is the client that has osteomyelitis and reports pain rated as 9 on a scale of 0 to 10. So obviously we would want to treat this client's pain, but it is expected with osteomyelitis. That's a very painful condition. It's not the priority here though. Option 4 says the client who has a lower leg amputation and reports paresthesia in the amputated foot. This is called kind of phantom limb syndrome sometimes. It's just those nerves that were severed are firing up to the brain. And we definitely want to treat this with some therapy and whatnot, but it's not the priority at this time. So our correct option is option 1.